Good afternoon, guys. I have your B for you. We're discussing infections in the elderly population. So here we go. Most older adults are especially prone to urinary tract infections, respiratory infections, including influenza and pneumonia, skin and soft tissue infections, gastrointestinal infections, including C. diff and norovirus, and reactivation of shingles. These account for the bulk of infection related illness and hospitalizations in people over 65. Quick guide: what to watch for and why it matters. Key considerations: age related immune decline, immunosense, chronic disease, diabetes, COPD, heart disease, functional status, immunobility, incontinence, and uh, congregate living. Nursing homes raise infection risk. Typical atypical signs in older adults. Confusion, sudden functional decline, loss of appetite, or falls may be the only sign of infection. Fever and classic symptoms are often absent. Most common infections in the elderly: urinary tract infections or UTIs. UTIs are the single most frequent bacterial infection in older adults and a leading cause of antibiotic use and hospitalization. Risk increases with incontinence, catheter use, and diabetes. Respiratory infections, influenza, pneumonia, RSV, COVID-19, pneumonia, and influenza cause a large share of infection related deaths in seniors. Vaccination reduces risk and severity. Skin and soft tissue infections, cellulitis, pressure ulcers, infections, MRSA, thinner skin, poorer wound healing, and diabetes increase susceptibility. Gastrointestinal infections, norovirus, uh, C. diff outbreaks in care facilities, and antibiotic exposure make these common and sometimes severe. herpes zoster, shingles, and dental oral infections. Reactivation of varicella zoster is more common with age and can cause prolonged pain and complications. Poor oral care raises risk of dental infections, sepsis, and bloodstream infections. Any of the above can progress to sepsis. Older adults have higher sepsis incidence and mortality. Vaccinate annually. Influenza, pneumonia vaccine, shingles vaccine, and COVID-19 boosters as recommended. Hygiene and wound care. Hand washing, prompt wound cleaning. Pressure injury prevention and dental care. Reduce modifiable risks. Minimize unnecessary catheter use. Optimize diabetes control. Encourage mobility and hydration. When to seek medical attention. Risks and red flags. New or worsening confusion. Sudden decline in function. Fever, shortness of breath. Decreased urine output or persistent diarrhea warrants urgent evaluation. These can indicate serious infection or sepsis. Older adults most commonly get urinary tract infections, bacterial pneumonia, skin and soft tissue infections, including MRSA, C. diff, gut infections, and bloodstream infections. Sepsis, many are preventable with vaccines. Hygiene, catheter avoidance, wound care, and antibiotic stewardship. Quick guide, key considerations and decision points. Key considerations: age-related immune decline, chronic disease, diabetes, COPD, immobility, incontinence, and conjugates living raises infection risk. Decision points for caregivers and clinicians. Prioritize vaccination status. Avoid or remove indwelling catheters when possible. Treat wounds promptly. Review recent antibiotic use. Ask for C. diff, a most common bacterial infection in seniors. What to watch for: urinary tract infections, UTIs. UTIs are the single most frequent bacterial infection. Older adults and are common in people with catheters, incontinence, or diabetes. Watch for confusion or sudden functional decline as atypical signs. bacterial pneumonia, and lower respiratory infections. Pneumonia causes a large share of infection related hospitalization and deaths in seniors. Chronic lung disease increases risks. Vaccination reduces severity. Skin and soft tissue infections, cellulitis, infected pressure ulcers, MRSA, thinner skin, poor circulation, and diabetes increase susceptibility. Prompt room care prevents progression. Gastrointestinal bacteria infections, especially steroids, C. diff, antibiotics exposure, and outbreaks in care facilities make C. diff a major cause of severe diarrhea and hospitalization. Bloodstream infections and sepsis. Any localized infection can progress to sepsis. Older adults have higher incidence and mortality. Early recognition is critical. Prevention checklists. Practical steps. Vaccinate. Influenza, pneumonia, shingles, and COVID-19 per current guidelines. Hygiene, hand washing, safe food handling, and environmental cleaning in care settings. Okay, guys, that is your B for tonight, or for today. I will be back on later tonight for shows. I will see everybody later tonight for shows. For now, Gator Wellness, take care, folks.